I'm Charles Wote. I'm glad to be joined this morning with officials here at Juba Teaching Hospital. We are going to discuss more issues about the new infrastructure here. How is it helping to reducing congestion here? And in terms of safe points, we will also talk about some of the challenges and also some of the preventive measures that the hospital administration have come up with to ensure that the patients do not catch coronavirus here.
I am Dr. Isaac Cleto Rial. I am the Director General for Juba Teaching Hospital. I am a surgeon by profession. And we are pleased to receive you. As per your concern, the policy came out of the Ministry of Health for expanding and modernizing Juba Teaching Hospital because of the conditions, we put it correctly, and of the old buildings since this hospital was established in 1927. So the policy of expanding the hospital started and it was implemented, and we started late last year to make use of the two buildings. One of them is a complex for obstetrics and gynecology, that is for women diseases and for delivery, and the other one is for accidents and emergency. That is the old term is the OPD. And who am قسم بتاع النساء والتوليد وقسم بتاع الحوادث. يعني expansion التوسع يعني if you go back before this expansion, let's take accidents and emergency. There are 40 beds only for emergency and accidents. هو الحوادث والإصابات كان عندنا 40 سرير. هسي المبنى الجديد فيها 120 سرير. Option Gaina is around 50 beds in the past. Now it is 120 beds. So this one helped us a lot to improve the service to the people. And other أخصائيين, those doctors who are giving services qualified, has increased markedly. Now we have got the accident emergency receiving emergencies in surgery and internal medicine. This is mainly in the first building immediate at the gate. And the emergency for Ops and Gyna is in separate unit. So the whole complex for Ops and Gyna is for dealing with the disease of women. Emergency, elective, follow-up, deliveries, labor rooms, even theater. So we have got two new theater complexes in the new buildings. Now if a patient comes, the patient will get all the services in Ops and Gyna in one place, in one building. The most important part of it is the increase of the number of human resource in various areas, be it in general surgery. Previously there were around 3 surgeons or 4. Now we have over 9 surgeons. Ops and Gyna, almost 15 obstetricians. Before there were only 4. And there are young, energetic physicians and consultants who are rendering the service very well to the people. And the main aim of these services is to bring the service to the people, especially the common people. Simple thing is that in the past it was difficult to get consultants and services in Juba Teaching Hospital. With these new buildings and facilities, including diagnostics like CT scan, for the first time in the history of the country, we have a CT scan inside Juba Teaching Hospital. So all this one will help to render better service to the patients.
Okay. Now, Dr. Isaac, can you tell us how many cases are you receiving here per day? Let's talk about this gynecology section, or even also the emergency section that you were talking about. Yeah. So, how many cases are you receiving per each in a day?
For the accidents and emergency medicine and surgery, in the past we used to receive up to 100. Now over 350 cases per day. Similarly, in Ops and Gyna, the number has increased in that same figures. So we are pleased that people are accepting the services and the number is increasing. For example, in the past we used to have deliveries around 10 to 15 per day. deliveries. Now over 35 per day. So this one means that people are accepting the services, and we are encouraged that we are going to improve the service to the people.
أنا دكتور جاوين أنطوني أجاك. I'm the head of the accident and emergency. أنا أخصائي حق الباطنية، أخصائي باطنية. فنحن بدينا الشغل في الاكسيدنت and emergency في new building late of the last year. That's exactly at 23rd of December. فزي ما انت شايف هسي الاكسيدنت and emergency is a very big buildings. This place we call it observation room. That's mean for the hot cases. العيان لما نيجي هنا يعني بقعد at least for 30 minutes.
Dr. Isaac, let's talk a little bit about some of the diseases that you are handling or you are responding to here at Juba Teaching Hospital. So you talked about the renovation, how you were operating before, and now with the introduction of this new infrastructure, have you so far bring new equipment, and what are the common diseases are you handling now here?
If you talk about general surgery or an orthopedic, that is Jiraha or exam, common cause here of the patients coming is trauma. Trauma mainly is the road traffic accidents. And there are common surgical conditions like acute abdomen, that is problem inside the abdomen from infection of the appendix, then التهابات بتاع الزايدة, we have got perforations and intestinal obstruction, يعني التواء بتاع المصارين وكده. These are the common causes that we handle in surgery. In medicine, it's commonly always fever, malaria, diarrheal diseases, and chest infections.
Do you have X-ray machines, and how is it working? Can you briefly tell us more on that?
We have new diagnostic machines, X-ray machines which are digital. These are first time in the hospital, plus the CT scan for the first time in the public hospital in the country. We have a CT scan machine, which is now operating. And we have got Doppler ultrasound. This is more advanced type of ultrasonography. هو موجات صوتية Doppler اسمها.
Whenever a person enters this building, where does the person start? Can you explain the process?
العيان لما يجي لما يخش من المدخل قدام هنا الامامي في تيم بيكون قاعد هنا قدام في حاجه اسمه فرز يعني هيفرزوا العيان that we call it triaging. That's mean بيفرزوا العيان. There is some of patients they are hot cases. That's mean they need emergency or urgent services, and there is some patients those who are stable we call them cold cases. ففي قسمنا جوا هنا سيرفيس لهوت اند كول كيسز. فلما نلقى العيان بيجي بيسجل البيانات حقه وبمشي على حسب الحاله حق العيان.
That means up to now you are handling any different types of emergencies?
We are handling many different type of emergency from the surgical part and from the internal medicine part also, and from the orthopedics ناس العظام حوادث القد تحصل، والامراض الثانيه في قسم الباطنيه مثلا زي الملاريات والهمه والحاجات الثانيه. We are handling it.
So what could be the general statistic of accidents or emergencies that you have received so far?
So far per day the rates is ranging in the total will be like 350 up to 450 patients with difference. Like what I mean by difference يعني في بعض منهم بكون يعني حالات الحوادث، في بعض منهم بكون امراض مثلا زول عنده كان مرض قلب يا ضغط ارتفع ب خالص يعني. فعندنا حالات مختلفة في emergency. For those is the total number كله. Then
Okay, finally, what could be your general advice to the public, being somebody who's working with emergency cases here at Juba Teaching Hospital?
my advice to the publics يعني بنقول لهم بأن جوبا تيشنج هوسبيتالز يعني في تغييرات كثيرة حصلت وكل الخدمات موجودة. فناس ما يقولوا بأن جوبا لسه زي ما كان زمان. فلما تجي مستشفى جوبا الكهرباء الحمد لله يعني كهرباء for 24 hours. عندنا بابور لو كهرباء حق السي تي باور قطع بنشغل البابور. ثاني حاجه بتلقى دكتور موجود 24 ساعه ما وحتلقى الخدمات الثاني يعني صور الاشعه والسي تي سكان والالترا ساوند وبعض من الخدمات.
Now, you talked about accidents. What of the cases of rape? Have you received some of these cases? And compared to last year, give us a statistic. Is there any increase or decrease this year?
So far, there are, I think, minimal cases, which are around 2 this year, that we receive in the. We have got an IDU center. Not IDU, it's called the one-stop center, which deals with that. And we receive them in Ops and Guyana, but they are not an increase as it used to be in the past. They are being cared for. We have Ops and Guyana consultants. We have stop center to care for their victims if they need any care, even counseling, medical and legal counseling inside the hospital. Yeah.
Great. Now, talk to us a little bit about some of the supplies. So, where do you have enough drugs, or are you, whenever you diagnose people with different diseases based on what you are explaining? So, do you have enough supplies? Can you talk to us a little bit?
Yes, about the supplies for this is the area which is very important to us, which is the main challenge that we face. We rely most of them from partners that supply us, especially the HPF, that's the Health Pool Fund, that supply us. And this links straight away with the issue of budget to the health from the government, which we very much wish that it should be looked into critically and increased. Because for the last 5 years, we received mainly donated medications, and most of the time the essential items are not there. So we need to buy them.
So how do you want the government to increase, or the partners?
To increase to change the system of how the drugs are being issued. We have got 2 systems. That is the push system, in which you donate and give anything that you wish to give. And the ideal one is the pool system, what we as a hospital actually need. So this is what we want to be very clear, that we need our needs to be taken into consideration before the drugs are supplied.
Mm-hmm. Okay, now talk to us about the number of doctors. How many, or health personnel, how many do you have here, or the numbers of doctors, and also their salaries? Are they receiving?
Yeah, we've got around 35 consultants now in the hospital, and 60 medical officers. And then we have got trainees, these are house officers that keep changing, and around 400 nurses. One of the issues was that the issue of motivation, that the salaries, they don't come in time, and they were not enough. And we also this is one of the areas that we ask for the increase of the budget, such that the staff are motivated, and together, although we're going through very difficult crisis, that these salaries at least come in time.
So are they all being paid by the government, or some of them are being paid by their partners?
All the staff of the Juba Hospital are paid by the government. Mm-hmm. By the government, on the government payroll.
Great. Now, what are the common challenges, despite some of these achievements that you are talking about, Dr. Isaac? So, what are the challenges facing you as per now?
Yeah, but one of the main issue is that as we coordinated with the issue of the salaries, the issue of people living around Juba, our staff, to transport themselves. As I say that the salary is not enough and then they don't come in time. So most of the time you have difficulties of the staff coming to the hospital. So transportation is very, very important. Number two, sometimes the tools, as I said, the drugs are not enough and people, but now with the new strategy, we are motivated that the environment has changed. That's one of the issues. Again, the environment was very bad, but now we have good environment. The other issue is the continuous supply of power and continuous supply of water. These are very essentials for the hospital.
Some of these services being provided by the government or even the partners?
Mostly by the government, and there are some partners supporting, as I mentioned about the supporting the issue of the drugs.
And then why is it a challenge then?
Because, as I said, the way it is being supported, like the issue of the drugs, it is sometimes the drugs being brought as a push system, and then most of the time the essential things that we need, we don't get. For example, for the theater to operate, we need essential things like gauze, suture materials. These sometimes they don't come in the consignments. So if you don't have a suture material, how can you operate on?
So you buy them.
So you have to buy them. Yeah.
So now, you talked earlier about challenges regarding the salaries of the health personnel here. How much is a doctor receiving, and when was the last time they received their salaries?
Well, for example, me as the most senior, I get around 7,000.
SSP.
That's South Sudanese pound, of course. All our salaries is in South Sudanese pounds. And as this is the highest paid, now you go down the line. So it is challenging, and yeah. But we are coping with that because we feel that to run this hospital is very essential for saving lives, especially those of the poor patients.
So when was the last time you received your salaries?
I don't remember much, but it is, I think it's August. August was it? Yeah, August.
Okay, finally, Dr. Isaac, what are the preventive measures have you put in place to ensure that the patients do not catch coronavirus? So can you talk to us a little bit on these preventive measures?
Yes, from the gates, as you enter, we have got stations that we make sure that you are wearing masks, temperatures are tested, and sanitizers are used, and washing hands. Stations also applied inside the hospital from the main gate.
Great. What could be your final advice to the general public? Maybe there's an area I didn't ask you for that you want to put across.
The main is a simple message that Juba Teaching Hospital is now picking up, even competing with the private sector. Because these are the same people who are doing the same consultants that work in the private sector are now in Juba Teaching Hospital. So my main message is that please come to Juba Teaching Hospital, especially those who might have lost confidence that Juba Teaching Hospital is ready to give services. Make sure that this issue of corona is well understood and it is real. Wear mask, social distancing, and protect yourself and your family. Thank you.
Thank you so much, Isaac. Today, the Don't Show decided to come to Juba Teaching Hospital to assess the progress of the new infrastructure. We have talked to the Director General of Juba Teaching Hospital. We have talked to some of the officials. We have toured some of the new building, especially the emergency section, where we have seen different sections. What are the services that they are offering to the public, and how are they receiving the emergency cases here? People are coming almost every day with different cases of emergencies. Thank you so much. I'm Charles Wote, reporting from Juba Teaching Hospital.